So I'll tell you what, we introduced our panelists, and we're going to get to them in just a moment. But since Governor Lamont was good enough to join us for a couple minutes, let's go to you. First of all, Governor, thanks so much for being here. I really appreciate it.
And just because we're at a stay at home doesn't mean you can't go out and get razor blades on occasion, Dave. You guys see Saturday Night Live this weekend? Because they did the whole thing remotely on a screen that looked just like this.
Yeah. It's kind of amazing what we can do. Are you having all your meetings like this too, Governor?
I think we can lease out the Capitol building. Just make this a virtual town meeting for the legislature. Well,
I love it.
What would you like me to do? Would you like me to give you an update, or?
Well, here's. I know that you had a couple words maybe to say, just to share with us as we started. So I'll turn over the floor to you for a couple minutes.
Sure. I'll just say I sort of see two contrasting things happening in the state right now. As I look at hospitalizations, people being admitted to hospitals, which I think is probably the best indicator, the best metric of what's going on in terms of the spread of this virus, it is increasing. And it's going up. And it's going up in Fairfield County, it's going up in New Haven, and it's going up quite a bit in Hartford. And we are sort of a bit of a tale of two states, though, because in other parts of the state, the infection rate and the hospitalization is very low. So for me, what I'm trying to do is a small state also try and strike the right balance in terms of what is the response going forward. As you saw in, I think it was Michigan today, Lansing, Michigan, there are lots of protests saying, unlock me, let me be free. I was sort of amused that the governor there, cut down on the ability to buy gardening equipment. And one of the protests was we can smoke grass, but we can't mow the grass in Michigan, as sort of an example of the frustration. And here in the state, we've got petitions going around. The salon said, let's open up now. So what I'm doing, launching tomorrow formally is our back to work or open up Connecticut strategy. And I've got Ingenuity, who a lot of you know from Pepsi, and she's our sort of representative to the business community, large and small, by the way, since it's mainly the small business that I'm particularly hit. And Albert Coe, who's probably the leading epidemiologist and infectious disease guy at Yale. We put together a network of, 50 different specialists on both sides of that. And what we're trying to do is get people to focus on May 20th, since that's the date I said I'm not going to open up schools and probably not small businesses before then. And what will we know between now and then that gives us information we need? I mean, we'll have a lot of testing done by then, and Co can tell you what that means. And hopefully we'll finally have our supply of, gowns and masks, what that means in terms of getting people in the service industry back. And that will give us a green light in terms of what and how we can open things safely. And the other big date, Keith Fan, if I've got in my head, is July 1, because that's a date where a lot of the great fiscal support they're giving us really starts running dry. And what that means in terms of whether it's going to be a new supplemental coming out of the feds, or are we at that point in a place where we can say we've really got our economy moving. And it's too early to say right now, but that's the strategy I've laid out for our group as we present it tomorrow.
How much is the conversations with other states, neighboring states, how much impact is that having on some of the decisions you're making when it comes to small businesses opening up? Because obviously you're working very closely with Massachusetts and New York and the other surrounding states in a way that honestly isn't happening all over the country. I think a lot of people are giving you credit for that. But are you going to be making decisions on what small businesses are able to open when based on your experts' advice or the experts' advice that is coming out of New York or some other state?
Yeah, John, Connecticut is Connecticut. So we're going to do it based upon what we see. Because let's face it, our infection rates, even in Fairfield County, are a lot lower than they are in central Manhattan. But that said, I learn a lot by talking to the fellow governors. New York's got a state lab that's 10 times the size of ours, and they're leading on serological testing, and we'll be comparing notes there. But functionally, when it comes to, say, opening up bars and restaurants, we closed them down together with New York, we'll probably open them up together with New York. Otherwise, you just have a lot of people driving around to get that beer.
Yeah. I wanted to open it up to our panelists. Did anybody have a question for the governor? Jonathan raised his hand first. Jonathan, go ahead.
No, I'd like to change up a little the monotony of everything. I'd love to know which governor you like better, Cuomo or Murphy, because you work with both of them so much. Who's got the better personality?
Well, let's say New York is bigger and they're adjacent to me, and Cuomo may be watching, so that may influence my answer.
So you're more scared of Cuomo than Murphy.
Next.
Yeah, next. I know. Susan, how about you? You have a question for the governor?
I'm trying to figure out when everybody sleeps. I'm so impressed with the economic advisory board that you've assembled, but seriously, when do you process everything that's coming to you? And I ask that as a reporter trying to process the little corner of information I have.
That's a really good question. I've never had less time to digest and think about all the amazing input that really brilliant people are giving me. And this is a subject, I'm a sociology major who focused on history. So all of a sudden I just learned to pronounce hydroxychloroquine.
That thing.
You're doing it better than the president is.
So, but that said, I spend at least a few hours every day working with my advisors and getting a chance to think and digest about what they're explaining to me, and then how I present that to people who are just, some are scared out of their wits and some are ready to go out and party. And my job is to find that common ground, right balance, but at the end of the day, putting public health first and foremost.
Thank you.
I wanted to actually make a quick comment and then a question for the governor. I'm telling you, you came in so smooth and the jokes were flowing, and I was seriously channeling the Hollywood squares. I wanted to jump in and go, I'll take Ned Lamont for the block. I was, it was really good. I do want to ask you though, I think that the question that I get a lot in emails that people are saying, and there's no easy answer for it, but it's not fiscal, by the way, so you don't have to have Melissa McCaw on speed dial for this one. How do you, or can you even factor in the potential for a second wave? Because I'm amazed at the number of people who'll email me and say, why aren't we reopening yet? And by the way, when we do reopen, I want to be assured that I'll never have to close again. In other words, they want everything. They want to make sure that they're open soon and there's no chance of a second wave, let alone a third. But is that factoring into your discussions and your deliberations, which is the potential, no matter what we do, that we may have to shut down again this fall?
It'd be a gut punch. I factor every day, I think about that. And I see that Hong Kong is shutting down bars and restaurants now where they didn't do it in the first wave, given the international travel, and Singapore and South Korea. And they do have the beginnings of what looks like could be the second wave. I remember every day that, 1918 pandemic, misnamed Spanish flu, many more people died in the second wave than died in the first wave. And I care deeply about, confidence and getting people back on their feet. And I know how demoralizing it is being stuck at home and your business shut down and absolutely zero revenues coming in. And that's why you want to get back to work fast. But nothing would be more of a gut punch for this state or this country if we let that second wave engulf us sometime later this summer or early fall. And Keith, some people think I spend too much time talking to my fellow governors in Connecticut. We're our own leaders. Let's do our own thing. But that second wave, like in Hong Kong, it came from overseas travel. We found out in Fairfield County that Metro North and I-95 is the COVID corridor. It just, New York, Westchester County, New Rochelle, remember that, all the way up through. So I cannot think in isolation. And, I never begrudged, Cuomo getting all the gear he needed, because the faster he puts out the fire in New York, the better it's going to be for me. And to a lesser degree, vice versa.
Governor, I wanted to ask you a question that someone sent us. We've been asking for questions from our reading audience on the Mirror site, and a lot of people have been writing about the status of prisoners in Connecticut's prisons. And we got this letter from Sharon, and she says, I'm not sure if someone can help me. Her husband, Jorge, is an inmate in Connecticut, but she lives in North Carolina. What she's hearing is, she says that they might release low-level prisoners. Jorge's a level 2. He's got 4 months, give or take, on a sentence. My question is, what are they going to do with inmates like him that are from out of state, that are low-level, and don't have or aren't causing any trouble? As you know, we now have in the hundreds of inmates and correctional officers who have tested positive for coronavirus. I guess I'm wondering what you think the next steps are to take care of the prison population in the state.
Yeah, I can tell you, Roland Cook and his team are doing the risk assessment on everybody there, especially those that are closest to being allowed to get out, especially those that are maybe older and the most vulnerable. You know, I know there's some temptation, and I've got folks protesting in front of my residence here every few days, you know, let them out. And I appreciate more than anybody that all these congested environments, be it the correctional facilities, be it the homeless shelters, be it the nursing, are just petri dishes. That said, I think we've done a reasonably good job because the population is at the lowest level in a generation or so. We do have a lot of extra capacity there. We can get people higher health care. We can recirculate the air. We can get them often. They'll be in better position to heal or stay safe there than if they get out. But that said, we're letting everybody out we can. You know, in the case of the first guy that died, we had tried to get him out of there, and we just couldn't find a place to place him, be it family or some other safe quarters. So while we have 800 fewer folks in corrections today than we had just 2 months ago, a lot of it because we're not having people go in, as you read in, I think, the Mirror. I think we're doing everything we can to decongest all those areas, including corrections.
Yeah. I think we maybe have time before the governor has to go for another question from our panelists. Anybody want to weigh in real quick?
There's some questions from some of the audience. They want to know what's being done to ensure undocumented immigrants can get testing and care that is humane and helps them keep from spreading the virus.
Yeah, we did that under an executive order, I can't remember when, which is very clear. Okay. Everybody, including the undocumented, your testing, your treatment is covered. And there's no ICE, so I don't want anybody to feel at any risk. If you're an undocumented individual and if you're feeling bad, you're feeling sick, you've got a permission, we'll get you tested and we'll take care of that. I was really happy today that insurance was able to negotiate for all of our first line responders. They, many of those nurses, they have really high deductibles and co-pays, and we got rid of that as well. So just like for Medicaid and Medicare, everybody is covered, and that includes Susan, the undocumented, because this is a virus that afflicts us all, and we really are in it together. We better take care of each other together, or we'll all be worse off. With that said, now you asked me what I do. Now I get to go home. I'll see Andy. Maybe I'll have a glass of wine. Thanks, everybody.
Thanks, Governor. Thanks so much for doing this. I really appreciate it. Ladies and gentlemen, Governor Ned Lamont.